Okay, good evening, everybody. Okay, so we have everybody on the call and also on Facebook Live. So we're back again on a Saturday, our last Saturday before Ramadan. So our friends, our Muslim friends will be celebrating, be welcoming the month of Ramadan, where be fasting, and also some of our Hindu friends and Sikh friends as well. They're going to be celebrating their Tamil New Year and Vaisakhi. So it's going to be quite a busy few days ahead. I mean next week. So hope everybody has been doing good. So tonight we are back again, and on Ask the Experts session, where we are talking about mental health. We talk about physical health, whether it's both mental and physical, body, mind, and spirit under PRKPP and also FitUnit. So together with us, we have quite a few people coming in. That's great. Thank you so much. So while we wait for them, also we have our regular Coach Wong, we have our regular panel and speaker, Prof. Mohammad. And yeah, so tonight will be a special topic. We'll be talking on something that everybody needs, everybody will do, everybody will need a lot, which is essential every single day. We'll be talking about essential the entire COVID, right? So this is really essential. This is daily essential, and it'll be interesting because we do need it, but somehow we don't really put a lot of importance into it because we sometimes take it for granted, right? And it's none other than sleep. So today we'll be talking about sleep hygiene. We always talk about washing your hands, and we talk about making sure that you don't touch your mouth, eyes, and nose when you're going out. So today we're talking about hygiene, but in terms of sleep. So, Prof, good evening, Prof.
Good evening, Felicia.
Yeah, so
Uh,
very excited to be able to hear from you, and then we can discuss about sleep hygiene. So the floor is yours.
thank you, Felicia. All right. So, as tonight, the last time Noreen did ask about her difficulty with, had to have a very good sleep. She needs some kind of, assistance to help her to get to sleep. So tonight I will be talking about sleep hygiene, and I think it's a very important topic for all of us to understand. So before that, once again, welcome. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera to all. So I hope with this sharing, it gives you much understanding of what sleep is all about and how we can actually, at the end of the day, have our sleep. We got a healthy sleep, I would say. So let me share with you the slides. Okay, just hold on. Let me just put it to the first slide. Okay, I hope you can see. Let me just make it big.
Yes, we can
All
see.
right, then. So the topic is with regard to sleep hygiene, as what Felicia has said earlier. It is now we are looking into whether our sleep pattern, our sleep is actually good enough and causing us to become healthy and subsequently affect our everyday life in a much better way. So tonight the topic is about sleep hygiene. So before that, I need to just go into a little bit understanding about what is going on with our brain. So we go into what we call the brain wave. When we are fully awake, we are in the beta wave. This is where we are fully conscious, alert. And then subsequently, when we quiet down, it goes down to the alpha wave, which is much slower, more relaxed, more calm, more clear, and not the thinking kind of situation. Subsequently, when it's going to be in the evening or towards the night, we may have going to sleep. We call it theta wave, and this theta wave is causing us to have deep relaxation, or even during meditation, we can have this kind of a theta wave. That's when we actually try to achieve trance state. This is where the theta wave is. And subsequently, when we fall asleep, we become more and more unconscious, so it become more and more deep, and this is the delta wave. But on top of that, actually, if we are intense in concentration and learning, we have what we call the gamma wave. And the beta wave is usually when we are fully alert, we are actually conscious, and then we do what we call problem solving and engaging, and we reach alpha, we are relaxing and recharging, and once we go into theta, we are in a dreamy state. That's usually what we call in the subconscious state, where we are in the autopilot situation, and that is also there is learning there. Subsequently, when we get into deep sleep, and this is the delta. And as you know, sleep got four stages, but actually we can also name it five stages. When we are stage one, we are falling asleep. It is still a light sleep. And then subsequently, we go a little deeper. At stage two, the heart rate slows, the body temperature drops. And by stage three, stage four, we go into deep sleep. And the muscles and the tissues at this point of the time is undergoing what we call conservation and is undergoing repair. And then subsequently to the last 2 hours of our sleep time, we achieve what we call REM sleep. When the first three or four stages is actually the non-REM sleep. REM sleep means rapid eye movement. At this point of a time, we are actually much more coming out of our sleep. So even though the body is paralyzed, but we can clearly remember our dreams. Here again, it indicates what it is, the stages of sleep. In stage one, we are still very light sleep, but our muscles start to slow down. By stage two, our breathing pattern, our heart rate slows, our temperature also decrease. And then we go into stage three, we start to go into sleep, deep sleep. At the first, usually sleep with non-REM sleep to start with, and that is deep sleep. The brain start to generate slow delta wave, and then we go into much deeper sleep, that is stage four. Then the muscle activity is becoming more and more. This is called where sometimes we felt that as though there's someone push upon our chairs, or we cannot move, we become paralyzed. And then subsequently the REM sleep, here we call it stage five. And when the brain wave begin to speed up again, here the dreams occurs and the heart rate start to increase. And we can remember our dream if we wake up at this point in time. And according to the duration wise, the first 7 hours or the first 6 to 7 hours is light sleep into a deep sleep. And then subsequently, when we have our last 2 hours, it is in the REM sleep. And the REM sleep is where we become, the brain waves become more active again. So the duration of the sleep, usually 75% is non-REM from stage one to stage three or stage four. And then subsequently the 25% over the last 1 or 2 hours. That is the rapid eye movement. We can see if we observe those who are sleeping at this point of a time, we can see that under the closed eyes, under the lids, you can see the eyes moving rapidly from side to side. This is another way to look at it. This info graph shows that from 12 midnight, usually at about 2 hours, if you can start sleep at 2 hours or at 12 o'clock, by 2 hours or 3 hours or so, you have a deep sleep. And subsequently, towards the end of the waking hours, you have the pattern is you go up again to wake up. So this is how the rhythm is shown in the sleep-wake cycle. And when you reach again the night time, it will help you to sleep. And this circadian rhythm is actually assisted by our so-called melatonin. With the secretion of melatonin, it actually makes us sleepy towards about 6 to 7 in the evening, or maybe 8 in the evening. By then, we can actually initiate our sleep, and we feel very sleepy by that hour. But unfortunately, nowadays, because of lifestyle, because of activity, because of job, because of nature of our life, usually we try to go against the effect of the melatonin, and we don't want to sleep at that hour. So that's why we have difficulty later to get sleep uh, much later in the night. So the purpose of sleep, as you know, these are the purpose. There are many. One of it is restorative function, where all the tissues repair, the synthesis, the protein synthesis comes about. Another one is with regard to the energy conservation. So the metabolism decrease, and once the metabolism decrease, we did not use much of our energy resources. Then the immune system regulation. So sleeps, importantly about sleeps, because sleeps with proper sleep, with good sleep, sleep hygiene, our immune system will be actually replenish, getting much stronger. If we have not been sleeping, our immune system will go down. And subsequently, with regard to the brain itself, it is also create what we call synaptic hemostasis. So the brain plasticity takes over a lot of the degenerative process in the neurons and dendrites. So at this point of a time, they start to actually recuperate and improve, and then the brain can actually, even though undergoing degenerative process, with active, with stimulation, and with good rest in terms of sleep, so the brain can actually regenerate into a new other neurons and dendrites and synapses. Also including memory consolidation. Basically, in the sleep, actually you can sometimes you can even realize a lot of memories that comes up during that time. And then we got this ontogenetic brain maturation. This is for during the infancy stage. So there is improvement of the brain in terms of the growing child, and also in terms of the lymphatic sleep system. So that also it helps a lot with regard to restoration and much better for the body health. So now the problem is a lot of people having this issue of can't really get to initiate the sleep. They may try to sleep at 10 o'clock, they are in bed, but unfortunately they toss and turn and they were not able to sleep. This is where we call difficulty to initiate sleep. Sometimes they only was able to sleep when they become so tired, maybe after many hours of tossing and turning, and become distressed. Then when they become so tired, only then they can sleep. But unfortunately, if they have some duty to do the next day, so that sleep become a very minimal sleep amount. So they wake up in a very groggy manner. They were not able to actually continue with the daily work because of poor sleep and what we call sleep deprivation. So what is sleep hygiene? It's basically a set of practices, habits, and environmental influence that impacts on one's ability to optimize sleeps, and must be in the continuous regular basis. So if somebody can actually, even though they want to change their sleep pattern, so they cannot actually change the sleep pattern too fast in a very quick manner. Example, today they work in the night shift, and then 3 days later they want to go into the day shift, and then the 3 days later they go back to evening shift, and then 3 days later they go into the night shift. The so-called the patterns very haywire, and because of that is the sleep has get into trouble. So if you want to have a proper sleep hygiene, a healthy sleep, you have to have a set of practice or habits and how you can manipulate the environment on a regular basis to actually help you to get the optimum of your sleep so-called quality. And those who have inadequate sleep hygiene, it is definition, inadequate sleep hygiene is a sleep disorder. This is because of the performance of the activity of the daily activity that is not consistent with the maintenance of good quality sleep and daytime alertness. So basically, if you have problem with sleep hygiene, so it will go into a situation, it's getting more and more worse because you're not able to maintain a good quality sleep and you have problem with regard to your daytime alertness. So the other name for inadequate sleep hygiene is bad sleep habits, irregular sleep habits, right? Or you abuse your sleep and whatnot. So always remember that in all of us, at least for 6 to 8 hours, we must allocate our body to recuperate, our body to restore, our body to conserve, our body to heal, to repair. So this is where it is very important. You must get at least 6 hours of a good night's sleep. And why we call it a good night's sleep, and then we will see later how actually even a daytime sleep is not the answer to the problem. It's not the answer to improve your sleep, to be sleep healthy. So insomnia, a lot of people who cannot sleep, we call it insomnia. So the definition is either they have difficulty to initiate sleep, or they have difficulty to maintain sleep, or they have a problem of waking up too early. They call it early morning awakening, or their sleep is not restful, not restorative, very poor in quality. So this is where the insomnia terms come about. And this difficulty, even though the above difficulty occurs, despite adequate opportunity and circumstances for sleep. What does it mean is that usually this kind of insomnia definition is how we describe for major depression. For anyone with a major depression, we will say that they have difficulty to initiate sleep. When they try to sleep, they cannot continue sleeping for that number of 4 to 6 hours or so. They got interrupted sleep, and then once they wake up too early, they cannot get back to sleep. And at the end of the day, during daytime, they become so tired, they become groggy, they are not able to function properly because this so-called major depression, it goes beyond 2 weeks. And when it goes beyond 2 weeks, it goes by months or so. So they were not able to actually have a proper restoration. So this chronic problem leads to actually poor quality in their life. So insomnia, these are the causes possibly. Here, I would like to highlight quite a number of time. Most of us, maybe for the young generation, a younger age, and possibly not an issue of drug and alcohol. Some may have what we call this nicotine addiction. That could also cause them to be, because it's like a stimulant, it will cause them to be fully awake and difficult to fall asleep. Some old age person, some elderly person, maybe in the 40s, starting from the 40s, they already have some health problem. They also on medication. That can also cause them to have trouble with the sleep. But mostly the younger age group, they have problem with their lifestyle. They have problem with their actually thoughts, their beliefs, and quite a number of us actually are under stress, having worries, having anxiety. So that are all the reason possibly we can look at the different category, the different groups of things that would happen to cause them to have insomnia. So how does we define sleep disorder? It must be a group of sign and symptoms. We always look into medical condition, psychiatric condition, anything, surgical condition. We look into sign and symptom. We call it syndromes. So it is characterized by the disturbance of the amount of sleep, the quality of sleep, the time of sleep, or in behavior or physiological condition associated with the sleep. So they have all these characteristics, and actually there are many, many different sleep disorders. And most important, the condition must be persistent. It causes significant emotional distress, and it's also interfere with their social and occupational functioning. So that's why when we name or we label someone with a disorder, it is not just based on one symptom or one sign. It must actually covers many characteristics because that labeling may stay for a while if once we start having the label upon the person. So first and foremost, if you are worried, if you are actually having stress, if you have a lot in your mind, you have a lot of issues to think about. Now the question is that how can you quiet a busy mind, especially when it is really time for you to sleep in the night when it is supposed to be a restful sleep. So you need to actually quiet your mind. So in fact, later I will give you the tips on how to quiet the mind. So a quiet mind is all you need actually, and all else will happen rightly once your mind is quiet. Unfortunately, when our mind is muddled, when our mind is full of things to think of, We call it overthinking sometimes. From one thought, you get into the second thought, to the third thought, and it becomes so complex that we also not too sure which one the one that started. And now we got so many thoughts that it's very difficult to undo all those thoughts. And that will make our very busy and not quiet at all. So how do you quiet the mind? So first and foremost, this is how the easiest way to actually be more relaxed is again to do what I said the last time around, breathing, a conscious breathing meditation. So begin with your conscious breath, because quite a number of times when we are not relaxed, it's because our breathing is not proper, and our mind cannot clear us off because our body itself is also getting in a situation whereby it is not relaxed. So we need to repeat with the breath, and every breath we can take it more and more deep, we can take it more and more slow. We can use diaphragm and it becomes a very good exchange of gases, and obviously then the muscle will become more and more relaxed, and we can get more and more sleepy, and our mind can be more and more quiet. So these are the sleep tips for sleep hygiene. So here let us look. These are the practices that we need to actually, as much as possible, to now look at ourselves, whether are we doing it right with regard to our sleep pattern. All right. First and foremost, we need to have a regular routine with regard to our sleep. If let's say we decide to now to get a good 8 hours of sleep, to wake up at about 6 in the morning, so we at least have to start sleeping at 10, and that means that sleeping at 10, you immediately can initiate sleep and you can get your sleep by 10 o'clock. So by 6 o'clock you are much awake, well rested, feeling that your body has been well restored, and you feel very great, and then you can start moving, doing your day again. So please remember that sometimes we are not really that sleepy in the night, because actually we are not just taking nap, but actually we are also sleeping during the daytime. So actually we have already disrupted the sleep that is supposed to be in the night time that goes into the daytime. And that is where sometimes we say that if you want to take that nap, it cannot be more than 20 minutes. So try to actually put an alarm if you want to take a nap, so that you don't go beyond that time, that actually you sleep in the day, and unfortunately by the time at night you are not able to sleep properly. And so once you go into your room to sleep, you have to actually shut down everything. No any distraction in the room. No phones, no TV, no messages, nothing that can come in. It is between you and your bed, and the place is actually dark and very restful kind of a thing for you to take a good to take a good sleep. How can you actually make it a so-called non-distracted kind of a situation? Some people use earplug to actually cut off any noises, any sound, and then you can use sometimes blindfold kind of a thing. You can put some of, over your eyes to close from any kind of so-called sensation, and also actually sometimes most important also, you must have very good environment where the temperature must be between 60 to 67 degrees Fahrenheit. Or I think if we can put our so-called aircon, maybe the temperature the most is maybe to 23 degrees centigrade. And use your bed only for sleep. And if you are a married couple, maybe you can have your so-called intimacy. And after you have that intimacy, obviously, you will be more tired and you can get a better sleep. Subsequently, also use socks to help signal the body that it is bedtime, or you can put on your pajamas, or you can put on your night gown, and that, so that it indicates that you are ready to go to sleep. Please, again, our main problem in our daily lifestyle now is actually we still take meals before sleeping. If possible, the last big meal will be not even after 7 p.m. That means a lot of times some of our so-called norms and culture among some ethnic group, they still eat a big meal, supper. So that will actually prevent them from getting a good sleep or even initiating a sleep. So maybe if you really need to have some kind of a drink, just a drink like milk or something of that sort, to just fill up your tummy so that you don't have to work up so much. Because by the time if you got something in your tummy, obviously the blood will flow down too, and that will make you sleepy too. So please, maybe you can add some white noise to your bedroom. Some people like music, some people like so-called, the so-called subliminal music, whereby it triggers their theta wave. So with this subliminal sound, maybe you can easily get into the brain wave that make you become more and more sleepy, and subsequently you can get to sleep better. So avoid taking all those substance, alcohol, narcotic, stimulant, anything of that sort, so much so that that will actually prevent you from getting good sleep. So this is where quite a number of time we take note that we may be a problem with actually number one, we have problem with number two because we sleep at the daytime, we have problem with number three, we have problem with number four because our home, our environment, the people around the house, everybody is not sleeping, but you want to sleep at 10, there will be a lot of disturbance, and then possibly some places are not really that conducive. The temperature and things of that nature is very important for us to consider to get a good sleep. We must actually in a situation whereby it is so conducive for us. And the other thing that we may have, beside 1, 2, 3, 4, 5, I think usually we also still take supper in the night, 1 or 2 hours before sleep. Sometimes we go for high carb kind of a meal. Sometimes, because there's a tendency we still are hungry in the night. It is not because that actually we are really hungry, but because it is already a routine for us. Once it is a routine for us, sometimes this is what we call automatic behavior. So we just look for things that we have been used to. It can become an automatic kind of behavior in that sense. And rules of healthy sleep also, maybe comfortable bed, comfortable room. That is also another important thing, because unfortunately for some of us maybe overcrowding, for some of us maybe not really having a nice socioeconomic status that would help us to have a better place to sleep. But in fact, if we surprised quite a number of our elders before, even though the places that they go into sleep was not really that conducive, but they will sleep very soundly. And that is because they work very hard in the day, they tire themselves very well. So by the time they reach the time for sleep, the body just take over, and then they were able to sleep despite the environment that is not conducive. And usually we say that you have to sleep in the dark. You must have this particular routine, the regimen of the day and the regimen of the night. And then when you should stop eating, when you should stop actively doing things, and then when you should go into your bedroom to start your sleeping. You must also be able to actually have a situation whereby you learn how to relax yourself. And I say consciously, there is a lot of way to relax. One of it is breathing. Another one is actually to scan the whole body when you are consciously, when you scan the whole body and how you feel good about when you look from the head to toes, that you can relax all the muscles. But these are all skill based, so you need to practice it again and again. Sometimes with assistance, maybe with audio help, with maybe initially with visual help, and also if possible with a very strong imagination, you can be more and more relaxed. People sometimes have difficulty to sleep, so basically reading is one of the way to make them fall asleep, much easier, much faster. So if you can't sleep, maybe just pick up a book, try to start reading, and you'll be surprised by the time you reach maybe second page or third page, you already can fall asleep. We are talking about the last possible small meal that you can take. People suggest kind of a liquid drink. Milk is good because again, when the stomach is somehow has something inside there, I think the blood will flow to the stomach and it will help you to also be able to sleep. And some also did some small exercise, take a walk, just do some simple kind of exercise that doesn't really over tired them in that sense, but it also helps them to fall asleep. So please avoid looking at gadgets, avoid looking at TV, doing things, avoid actually talking to people. So put them all aside. We are talking about is sometimes even the phone should not be in the bedroom. The phone should be put outside, and the bedroom is only for you to sleep. And maybe if you need to get help assistant to wake up, then you can put your alarm. But if you are already in a routine whereby your sleep is about 6 hours to 8 hours or so, usually your body clock will help you to wake up. And again, please do not focus on any issues. Do not try to dwell, to think about things that you are not happy about, that is not sorted out. Because if you start thinking, then the process of your mind cannot be quiet. So that could be a problem to you, leading you not to having a healthy sleep. And what happened if you are not sleeping very well? So we will have what we call the term sleep deprivation. And sleep deprivation in the daytime, you can end up sleeping. They call it narcolepsy, and this is already a disorder. That means once you just try to do anything, you just fall asleep. So that is called narcolepsy. And the cause possibly also you are already having insomnia. So at the end of the day, you become sleep deprived. You cannot sleep well. Maybe there's issues at home, a lot of expectation, a lot of demand for you to attend to, or maybe you have a delayed sleep phase syndrome. You have difficulty to initiate again for whatever the reason is. Like some people were saying they are afraid of the dark. Some people were saying that they cannot sleep alone. So this could cause them to have a delayed sleep phase. Or some of us cannot sleep very well because of size, because of weight, obesity. So we have what we call sleep apnea, obstructive nature. Once we try to sleep, our tongue fall back, it blocks our airway and things like that. Then we gasping for air. So basically, every time we try to sleep, we have into trouble and we cannot sleep properly. And then the other thing is obviously those shift worker. When shift worker, the time is that they are supposed to sleep, but they are doing their job. So they're actually forcing themselves not to sleep. And because of that, the body clock or the body circadian rhythm become haywire because of that. The way that they are tired, the way they need to sleep, but they were not able to. Or at least you're not getting your minimum sleep amount. uh, Surely we can say that the sleep amount possible minimum for each and every one of us maybe is 4 hours. So if you can get to 6 hours, that will be very good average. Some of us maybe at certain age we need to be having more of a sleep, maybe 6 to 8 hours. For the elders, you need to sleep more. For the youngsters, uh, maybe they can have 4 to 6 hours of sleep. So common, obviously, when you are deprived in the daytime, you become fatigued, you are very irritable, you're very moody, you're having trouble to focus, you're having trouble with your memory, you cannot concentrate. And what worries us sometimes, it can end up with actually simple hallucination, not really a schizophrenic hallucination, but you can hear things, they call it hallucination. You can develop ideation like paranoia, you feel that, people are not liking you. These are all actually a state, not really a disorder in the sense of a psychosis, but you can feel that because you are not rested very well. And then the symptom of tiredness after the fatigue, then you have what we call heavy leg, generalized weakness. You are losing interest, you have heavy head, heavy body, sore eyes, heavy legs. You can easily get into cold situation, feeling cool yourself, and you're quite sensitive to noise, to irritation around you. So that is where this fatigue syndrome comes about. So sleep deprivation is actually when there is a rapid deterioration of your mental and physical well-being. Usually, we noted that you cannot focus attention very well, and the other thing that could happen is your body take over. You have micro sleep, and this is what happened basically to actually quite a number of accident on the road. It's actually because they have been sleep deprived for a chronic time, and by then actually they were having micro sleeps while even driving. Sometimes even if they are so tired, they have been sleep deprived for a while, so their body takes over and they don't even realize what they have been doing. So unfortunately for any drivers on the road, a 3 second to 5 second micro sleep can end up with loss of life and a serious accident. For those with chronic sleep deprived, besides these micro sleep issues, they can also have heart disease. They can also actually have trouble, metabolic in nature, and also weaken their immune system. So basically, this is the key, the last word for us to remember. Enough sleep is just as important for good health as nutrition and exercise. As all we know that in our daily life, we have three portions of our time: 8 hours for rest, 8 hours for sleep, 8 hours for recuperation in that sense, and then 8 hours for us to do our daily activity, our duty, our responsibility, our job, and another 8 hours actually for us to exercise, to use the body accordingly so that the body is actually maintained very well. So the 8 hours is very important for us to take note. What can we do in the first 8 hours in the morning until the evening at 5 maybe, and then subsequently the next 8 hours before the last 8 hours for us to sleep. So this is the last slide. So I will stop the sharing and we can have our some discussion. Thank you, Alicia.
All right, thank you, Prof. I think you have summed it up very well. All the important things, what sleep from the theory about sleep to the how what happens how much sleep do we need to what are the disorders that if you don't get enough sleep. One thing that has cropped up, I think the last just recent years, I think it's about sleep and the correlation with sleep and memory loss or having good
Yeah.
memory. Yeah. So, why is it that we do need quality sleep, or I would say rest? Because some of us probably can sleep more hours, but or less hours, but doesn't mean that we have good quality sleep. So sometimes the
Mm.
hours doesn't dictate the quality of sleep. So, in
Yes.
terms of the memory, how does it help to actually improve? I think you mentioned something about just now. So the benefits about having a good sleep, and how does it affect our memory?
So basically, one about memory is in this case, it is not that we are losing the memory. We are not even registering any kind of information because we have trouble with concentration. We have trouble with focus. So when we have trouble with focus, new information, even though comes in front of us, it was not well registered. So actually, we don't lose the old memories, but we cannot gain the new memories, the recent, the new information. So it is not actually like dementing process, whereby everything will goes off immediately. Even if you are actually rather not really that sleepy, not really that tired, you still can have some but then again, it may become a very transient ability to focus because the body will take over. When the body is tired, the body takes over. The body says, if I want to sleep, that's why you can see some people just fall asleep. So if they have the case of like narcolepsy, if they are not sleeping very well, that is where the trouble comes. In fact, we have some people, some friend that we know, if they go into the meeting, they just fall asleep, even snoring in front of everyone else there, but they don't even realize that they have not losing memory of that dementing nature, but it's because of poor focus. And as you know, sleep help the brain to rewire had the brain to actually form new dendrites, have the brain to, as our brain is very plastic, they call it brain plasticity. So the brain actually can redevelop new dendrites, new synapses, new axon neurons. So that's why we need those kind of a thing for sleep
Yeah.
is like you say, the factory needs to have a good rest.
I think you mentioned that in your slide, synaptic homeostasis, that's the brain
Yes,
plasticity, right? Okay, yeah,
yeah,
and that also helps to increase in neurotransmitter. I'm guessing it also affects your mood, right? Whether you are
yes.
moody or you are happy or being at a productive mood, I think,
Mm.
yeah, definitely sleep plays a very important part.
If you don't have a good sleep, it affect your mood, it
Mm,
affect your thoughts, it affect your behavior. As you know, that as the last slide was saying, sleep is another big important element for body fitness. Things is important for the three domains in ourselves. The body domain need the nutrition, need the exercise, need the rest, the sleep.
mm,
Similarly, the psychology domain also need the same thing. The food that goes into the psychology, the
mm,
nutrient, the nutrition that goes into the psychology, the exercise of the mind, the psychology, and also the rest, so that they don't have any negative impact on the mind.
mm,
Example, if you are focused on overthinking, so it is overwork. So we need that rest. So similarly, the spiritual domain also need the same three component. The
yeah.
nutrient and rest, we call it the rest and recuperation. So that's why we got this R&R, where sometimes we take a break. If you want to know, in Western world, if you
Mm,
are a lorry driver, long haul driver, there is a ruling for all these people. Every 4 hours of drive, they must take a break. They
wow.
must actually go to the side, sleep for at least 2 hours, rest for 2 hours before
Mm,
they can move on. And quite a number of these long haul drivers, their vehicle actually has a GPS, and the authority will know whether they continue driving beyond the time that was limited for them. So
yeah.
this is under what we call occupational safety health
Mm,
issues. I think in Malaysia maybe they have this thing, but I've not heard because basically if you to see the long haul bus actually do many trips. I think the reason why they need to do many trips because the company maybe don't have enough drivers, so they have to go back and forth 2 or 3 times in a day for this long distance, and
yeah.
that actually will cause them to have to become
Vision has
tired and
mm,
having micro sleep.
yeah, I think that's very yeah.
Yeah, so we have to be aware of that situation.
It's a good thing to note that yeah, your brain does need to rewire and through sleep, whether it's body, mind, spirit, spiritual, nutrition wise, health wise, and also mental health, is that if you overload it, then you definitely need that rest, R&R, to actually work on it. Yeah, it's also good to take note as well, that if you don't get enough of sleep, especially at night, you tend to have higher cortisol stress levels in the morning, and
Yeah.
that would also lead to overeating as well. So one of the things that they find out in case studies is that people are mostly overeating or cannot control their cravings due to um, lack of sleep, actually, because the body is under stress, right? So the body tends to cope in different ways, right? Mm.
Mm.
Yeah, all
Very
right.
true.
Yeah, that's so there's a question from the floor from Sharida. Does too much sleep cause your mind to be inactive, especially for elderly? My 80-year-old dad tends to sleep for a long period, especially during the day. Can you clarify this, Prof?
Okay, when we see we can see the pattern for extreme of age here. You see children at 1 year old, at 2 year old, they have a tendency to sleep more than 12 hours in a day. Similarly, actually, the elderly will go back to the younger children age kind of a sleep pattern. They also have longer hours of sleep. The unfortunate thing is that even though they have these long hours of sleep, it might not be a restful sleep for them. So that could be the issue here. If possible, that's why I think Coach Francis and Coach Felicia, you have been telling us again and again, please be a very fit person. Please actually do exercise. And once you reach the age of 60, 70, you're still a very fit person who just need to sleep for 6 to 8 hours. I think that is the problem with quite a number of us who actually already insult and assault and abuse our own body, our own brain, and our own nervous system, whereby we are not having a good rest, but unfortunately, we end up become tired unnecessarily. We appear to be sleeping, but I would say it is not a good quality of sleep. Actually, there is a scale or index that we can use to test our quality of sleep. Yeah,
Mm.
so maybe later we can share the link so that you can try and see whether you have a good quality of sleep or not.
Yeah, recently as well, one of the things I've been doing is running. So, and it's also just not just blindly running. So, one of the things when we keep active, sleep also plays a very important part because it determines whether you can run well or not. So,
Mm.
one of the gadgets that I'm using now is the sports watch. It's not exactly 100% accurate, but wearing it yeah, in a consistent time and especially during the sleep, it can actually help to detect the resting heart rate. So
Yeah.
a good resting heart rate, the lower it is, below 60 or below 50 or 40, really
Mm.
determines the performance, right? And I realized it by getting sufficient amount of sleep. Hence why just now there was a little bit of an alarm from my side. It's actually my bedtime in 45 minutes. So those are
Oh,
things,
okay.
yeah, maybe we can discuss about the good sleep hygiene
Uh,
that can,
that is called yeah, that is called the regime that you put and your reminders
yeah,
for you to actually get yourself ready.
mhm,
Try not to have any more communication and
stimulating kind
start
of
to be
activities,
yeah,
yeah.
start to tell your friend that sorry,
Mm,
this is already my time to rest and things. I
mm,
think we have to be very firm with ourselves
right.
again and again. Actually, we actually again break our own routine, which is not a good kind of a routine. We continue with that. We have the choice. If we
Mm.
know now we got some knowledge, maybe we can determine how we want to do it the best way we can.
Mm-mm. But one of the things I find that perhaps sometimes sleeping during the day could mean a few things. It could be the lack of sleep from the night before or a few nights before even.
Yes,
There's like sleep debt that you need to pay back. So in the
yeah,
case of like sometimes we need to take note whether, I mean, correct me if I'm wrong, Prof. And this is like more of the common sense and logic that we use in during our coaching. It's a
yeah,
lot more to sometimes because we don't have enough oxygen into our body. So hence why
yeah,
we feel sleepy and things like that. So by doing
yeah,
some exercises and movement and workout, one may be able to feel a bit more energetic and making sure that also you drink enough water. Because one of the things that your body goes, there's experience with what we call fatigue
yeah.
when you don't get hydrated. So while
Uh,
we want to disturb the morning routine, we do all the necessary things so that our night sleep is more has more quality, right?
there is tips for you to actually overcome, especially in the morning.
Mm,
Even though you are actually sort of like at work, if you start yawning, it means that actually your body is inactive.
mm,
Your body is gasping for oxygen. That's where the yawn come in. So I think we have to change our lifestyle now. As much as possible, sitting is actually is the worst thing that could happen. I think Francis did send us a video, right? The worst of all many things is the chair, where we sit for long hours. I think I
yes,
saw that video. So
right.
the chair is the one that is the trouble us now. So I
Mm,
think we have to change because I think if somebody start yawning even in the morning, that means the night sleep wasn't a good one. If they continue yawning again intermittently from 8 o'clock to 9 o'clock to 10 o'clock to even by lunch hour, that means they already actually, as you said, sleep debt. They
mm,
actually did not get a very good quality of sleep. So what we can do now, as much as possible, every 2 hours or so, you must stand up, you must move around in your room. If you want to do duty now, you want to do, let's say, your computer work, I advise you to buy a particular stool, not a stool, but
Standing
buy
table.
yeah, a kind of, where you can put your computer at a very different level,
Yeah.
and you can do your work standing up basically. Pull
Oh,
away the chair,
nice.
put the table that you can actually, these are the portable table that you can adjust it. I have it one in my office, where you can adjust it, and you can actually do work standing up. And
Right.
then while standing up, while doing your work, you can move your leg, you can do static kind of a movement,
Mm,
whereby I think this is where the problem, if you still you stay for long hours, the key to the problem is that you may have actually thrombosis in your leg veins. For some
that's
of
not the
us
main
who have,
cause. Yes.
that is a similar thing that happened if you go for a long haul flight.
Mm,
uh, you can have the movement of the blood is not proper, it can actually get you into trouble.
wow.
They can cause blood stasis. So I think somehow we still need to at least move the calf muscles,
Mm,
at least circulate. I think like most of you all who are not really, for me, with overweight, obesity kind of a thing, that is even serious because the movement of the blood and the flow of the lymphatics and the limbs and whatnot are not very good. So
right.
we need to move on again and again. And
Mm,
remember that actually, if you start to yawn, that means you are already sleep deprived.
yeah.
You're already having sleep debt.
But if you're starting to yawn at night, yeah, that's normal, right?
Yeah, yawn at night is okay. Yawn in the daytime when you're supposed to be active, I think. Yeah, Coach Francis, what do you think of all those things now? I think you need to highlight all those to us.
Mm,
Actually, just now, I find it. But after knowing the symptoms, then
Yeah.
you will know that something is not right. Then we should go back and revisit all those sleep hygiene areas and work on it.
Yeah.
So it's very important to know the cause and effect of a lack of sleep. Correct? Yeah, I learned a lot today. Thank you so much. So sometimes we are tired. That's why we able to sleep. But we actually are still not enough of sleep because one day, as the saying go, you one evening, one night of lack of sleep in one night, you take 3 to 4 days to recover. Just
Yeah.
now you were mentioning something, taking a short nap to replace
Less than 20.
your lack of sleep is not equal. Can you explain a bit more on that?
yeah.
Why it's not
Okay.
equal?
Again, actually, once you have a sleep debt, you cannot replace the sleep. That is the key. There's no such thing actually, even though you sleep in the day, actually you already get a replacement of the sleep that you lost in the night. So the rule is actually, if ever you want to sleep in the day, if you have already got to have a good sleep hygiene, a good night sleep, you cannot go beyond that 20 minutes or so. So this is where people get a mistake. They thought that, well, I don't sleep for 5 days as much, but I can recover over the weekend.
Yeah,
Then I sleep the whole day on a Sunday or the whole
yeah,
day on a Saturday until I wake up in the afternoon. Actually, there is no such thing as that recovers the sleep debt,
yeah,
because you cannot pay back the sleep debt. Your body has already lost it. Your
yeah.
body is already weakened.
This
So
is yeah.
if you sleep over the hours and in the daytime, actually you become more and more fatigued because you're not active.
Mm,
Yeah,
If ever you want, again and again, by daytime, please don't ever get close even to the bedroom. Don't even get close to the sofa whereby you just sit idly watching TV for hours and hours, not doing anything more active. I think like you all are going for the urban farming. These are all very important things that we need to pull us all out, not doing those kind of things. If not, we are in deep trouble. I mean, like for each of us, like myself and
my
Francis,
goodness,
we are
right.
already in our sixth series, so
yeah,
we need to be careful.
yeah, exactly.
Yeah,
Mm.
yeah.
I think that's
Let's
really,
come here.
yeah, so I think that's really good. Yeah, meaning we cannot replace our sleep, even though we are obviously having lack of sleep. So it's just about readjusting our sleep much better,
Yeah,
or
yeah,
manage it better for the next couple of days for it to go back to normal. Yeah, having a routine is important. Like what you
People
mentioned.
say now, I thought every Saturday or Sunday I need to sleep that much. It is not. It is not actually not at all. So it is a bad routine.
Mm.
Yes, definitely.
Very-
It's as important as exercise and nutrition. Actually,
Yes.
it's so important.
Mm.
So anyway, I think it's part of my thinking is, incidentally they are a kind of tourism. They call sleep
Mm.
tourism. They get the foreigner to come inside to Belum this place, just for to rest and sleep. That kind of thing also people are promoting. Can you imagine how big is the market? So I
Yeah,
think
Okay.
people are
basically,
in dire of sleep.
it's important that, yeah, it's important if we have this so-called sleep recurring sleep deprivation. I
Mm.
think we should set an appointment to talk to the people, to talk to the psychologists, like Prof. Mohammad, to understand, to revisit some of the areas, because sometimes we need somebody to pinpoint and at the same time to give you the set of training to get out of that. Otherwise, you will continue to do and continue to do, then you get a lot of problem, especially the immune system, and then a lot of problem when the immune system is lower, you're open to all kinds of dangerous diseases, especially cancer. Yeah, I think that
Very
is
true.
important. Is part of my thinking. It's very important that we also need to a short course on this sleep hygiene,
Yes.
how to identify and then get out of it, because it is very true, especially some people, they are in the job environment, they so-called is a uh, uh, is a job risk, you see, because they
Mm.
work on shift. So I
Mm.
see
Yeah.
them, they really can't sleep enough because they work 12 hours, they come back, they got to cook, they got to do this, go get their children, and they go sleep for a short period of time. Then the next day they continue again. So I think it's very dangerous, hazard, occupational hazard.
Yes. Yes.
Yeah.
Actually, there is a ruling with regard to this sleep. This so shift worker. There is a ruling already. I think applied by no World Health kind of a thing. With
Mm.
regard to people working on shift. If you ever want to do a night shift, you have to do a night shift until your body get used to it. You cannot change this person to become a morning shift. So that means they maybe then change their circadian rhythm. People are sleeping in the night, they only sleep in the day. That is much better than actually disturbing your mind and disturbing your body, confusing it with that kind of a continuous changing of 3 days in the morning, 3 days in the evening, 3 days in the night, then goes back to morning, evening, night, and maybe between the time there's some 1 or 2 days break, and then go back to the same cycle.
Yeah.
So actually, this can be an issue whereby the company or the employer can be taken to task actually,
Mm.
because under occupational safety and health hygiene and the environment kind of a thing, it is already stated internationally how people should work. Unfortunately, I think enforcement is maybe not really that good because I've seen oil and gas kind of a place worker, especially when the situation of a turnaround for 2 weeks, nobody can get the rest. And
Wow.
when you are already weakened, you get into trouble. For us doctors, if we go on call for 36 hours, 24 hours, then we go into 36 hours, or sometimes we would go to 72 hours. We can't think clearly already. We can't perform clearly. We are not competent anymore. We need that time off
It's
actually.
true.
But
Prof,
one day off may not be actually,
yeah,
yes.
there is a the thing out there because some people they may claim like I'm a morning person, I'm a night person, and there are research that shows. I mean, I was discussing this with a trainer friend recently. If you're apparently born, I don't know if there's any truth in it. If you're born in the morning as a baby, you are actually a night person, and if you are born at night, you're a morning person. Is there such thing as a morning and night person? Like some people they just claim like I don't sleep at night, I'm born
That
for
that
night.
morning and night,
Yeah.
that morning and night is based on the routine that they have been putting themselves into. It is not about the birth age or not about the birth time kind of a thing. I think quite a number of us, as it is our physiology, by the time it is dawn or by the time it is dusk, melatonin is coming out for us to sleep.
Mm.
That's why a lot of time last time, our elders, they already able to sleep after 8 o'clock. They can sleep very well, and they woke up by 2 o'clock, 3 o'clock. They have got a very good restful sleep. But for us, we thought the sleep must be from 12 to 6. So it's not true. You can sleep at 8 if you're very tired, if you're very sleepy. You don't go against it. You sleep at 8, then you can wake up at 2. And if you got a good sleep, you don't need to sleep anymore. And that's why when in our culture, we were saying that that is the time for you to do your prayers. Then maybe you don't even need
Right.
to sleep anymore because you already get good rest. So sometimes people don't realize that part. So when we postpone the time, example, when we are very sleepy by 7 or 8, we used to have that kind of a feeling. We are so sleepy, but then we go against it, we postpone it. But by the time we want to go to sleep by 12 o'clock, we cannot sleep because there's no more melatonin. So because of that, we try to use some other assistant. So we take something to help us to sleep. So we already jeopardize our body physiology system. I
Mm.
think quite a number of times we don't even realize we insult and assault ourselves so much. Nobody abused us to start with. We abuse ourselves.
We abuse
So
ourselves.
this concept,
Yeah.
we abuse ourselves. We don't even realize. In terms
Right.
of food, in terms of lifestyle, in terms of sleep, all those kind of things. In terms of
Yeah.
thinking, in terms of mindset. Nobody form it for you. We just
Mm.
bring you to that realization. You can
Right.
have that
Even in the
realization, then you
Mhm,
maybe can have acceptance.
mhm.
Yeah.
Yeah, even in the recent coaching sessions that I have, sometimes you just act as a reminder to your clients on the importance of sleep, and the struggle is always talking about, oh, my environment, my children won't go to sleep, and then but it's good through mindfulness. Some people, they do realize that it's because they don't set up a routine. They don't switch off all the lights, they don't prepare their whole house
Yes.
to be at a sleeping conducive environment, so hence
Mm,
the children don't go to sleep, and they don't even, they are on the phone with the late night to catch up with their family members and things like that. So and then they wonder, how come I don't get to wake up at 6 a.m. but I wake up at 9 or 10 a.m., right? So these are
sure.
generally some of the real feedback. And once they start to take up, like you said, if we insult and assault ourselves, once they start to take responsibility, once we start to take responsibility, we switch off the lights, we go to sleep,
Mm,
prepare. Everybody else falls, everything falls into place. And hence why I believe there
yes.
must be some sort of routine, because yeah, we all work in a certain rhythm. We all need time
True.
to adjust. So like Ramadan is coming, you wake up at 4:30 or 5 in the morning, you have to move your routine. Hence why I think everything is very well prepared. You have enough time to eat, enough time to pray. All these things are part of a routine that helps you to do your duties without jeopardizing or compromising other things, right? Yeah, so everything in its time and place. So that's Prof, maybe you have some, before we close up for tonight,
Yeah.
you have some any mental relaxation or helping our sleep hygiene? Do you have any tips, or can you perform some sort of like
Okay.
techniques or anything like that? Mm.
Yes. To start with, remember just now there is this so-called noise, that so-called that white noise. Actually, all of us can apply that using that white noise. They call it a subliminal kind of a sound. There are many actually you can put in your room. I can actually listen it quietly. Don't even need to put your earphone into it. Just the room is so conducive about this so-called subliminal sound, which can bring down your brain wave from beta to alpha. That is already a conscious state. Now you want to go to sleep, then you can get into light sleep, then you can go into theta level, then subsequently go into deep sleep, delta level. So that white noise is very interesting. Actually, if you can try that, basically I would say it does help you. But that noise cannot be so loud to disturb your so-called
Let
hearing.
me
If
find
it's just
something.
nice,
Let me find something if we can.
yeah, you used to actually put up some kind of a subliminal white noise that you can use.
Okay.
I would suggest if that so-called just the sound, no other audio that actually disturb between the sound and the audio. So just the sound will help you to start with. Look for that. Later, we can teach you put away the sound, but just the audio about affirmation about that is actually to change the subconscious. That,
Okay, hold on. Let me just.
that is active sound that will
Yeah.
make you awake.
How about this one?
I would say if you go for Bach, for Beethoven, they are also subliminal in nature.
Oh, really?
Yeah, they are very nice, soft music. Also,
Okay.
actually having the tendency. Maybe I can suggest you others.
Let's see. Okay. Any? Does this sound very similar?
Okay. Yeah. You have to make it more soft. So it's like sometimes we realize if you go in a hotel, they
Mm-hmm.
put this kind of a sound whereby you feel so relaxed. And especially if you were in the foyer in the the ballroom kind of a thing, when you sit down, you listen to this music, you have a tendency to even like go into half kind of trance state.
Mm-hmm.
That kind of a sound that is they call it a subliminal sound. uh, as I said, maybe we need to put up something for us to continue trying it out. uh, but for me, sometimes not only just this sound, but even a far distant reading of Quranic verses, or a very far distant sound of zikir, we call it, can actually soothe you
Yeah.
because you were into it as much. So
Right.
we have a variety of things that we can use.
Mm.
But if you want to change your subconscious mind, you need those affirmation. You
Mm.
need those wording positive in nature to put inside the mind. And that is where we call it self-hypnosis
Mm.
or assisted self-hypnosis. Assisted self-hypnosis means maybe you already decide what kind of affirmation that you want, what are the positive things that you want to put in yourself. Then you can tape it, or somebody actually tape it already, and then you can listen to that, and you assume your position into this kind of
Mm.
audio.
How long
So
do you recommend to play this music? I think it's good to set up.
actually, you'll be surprised. The idea is once you go into theta, you fall asleep without even noticing it anymore. And
Mm.
that's what trance state is all about.
Mm.
In hypnosis, in hypnotherapy,
Mhm.
including in self-hypnosis, if you are becoming more aware of it, then actually your trance level is not deep. But if you can bring yourself to a trance level which is deeper and deeper and deeper, at the end of the day, you don't even realize it. But actually, your brain is still opening to receive the information.
Mm.
And the thing about hypnosis is that you can already set when actually you want to wake up. Your body already then take that message. You say that, okay, I want to listen to it and then fall asleep. And by 6 o'clock in the morning, I will wake up. Actually, your brain will start registering that.
Mm.
So in hypnosis, actually the most important is you must bring the trance level to as deep as you can until you can fall asleep if sleep is the issue here. But in our own therapy situation, we don't want the client to sleep. So we make sure that even though how deep we have bring them down, then we have to bring them up by actually counting upward,
Yeah.
by making them remember. There are instances when actually our client, we used to have a case when the person already fall asleep, but you'll be surprised, while we want to bring that person out, the person cannot come out of it because already quite deep in the sleep.
Wow.
So when we actually let it be, and then we actually continue saying that, okay, we want that person to be out, then we start actually putting counting upward kind of a thing. Sometimes the key here is that the longer you sleep, the much more you have to pay to us. so the person actually wake up very well. You know, so that is, you know,
Okay, but
we
this is
will
the
say that.
last. Yeah, this is the last question I have. Yeah, I think one
Yeah.
time one session we did was more like a mental relaxation. I did use some supplements.
Yes, yes.
So some it was corporate clients, right? So I mean this was offline and pre-pandemic. So they did end up some even in a class of like maybe about a good 20 to 30 people. So they ended
Hmm.
up like falling asleep. Some of them are just relaxing. Some of them like ended up snoring. So is the worst
Yeah.
like my question is the worst snoring is just like that person is obviously tired. But
Yes.
is it a good thing or is just normal to see some people
Uh,
or go into like really deep sleep and end up
yeah,
snoring.
it's okay. It's okay. You don't worry. Basically, if you want to let the person sleep, also okay. The only problem if you're in the session, with a lot of other people, obviously we cannot allow this person to be falling asleep that long to
Yeah.
disturb the rest to continue with the process. So
Mm.
we need to actually do and during that time, if everybody else is coming out, you don't stop actually your so-called communication
Mm.
with this person who is already about to sleep or asleep. So you
Mm.
continue and until actually you can bring them up. There are many ways actually to wake the person up.
Mm.
Sometimes even before you do this, you must already caution that person that maybe you need to even touch that person if he end up not fully aware of what's going on.
Yeah.
I mean, some people even blow into the eyes, some people even, touch the skin, but you must already inform before you get people into trance state. To touch a person, you must have the consent. That is all the important ruling that you need to, the ethics of doing things. Because that person is not really, not to say that they lost control, but people may take advantage of them.
Yeah.
These people who can sleep very well, these people who can actually goes down very well into the trance state, they are what we call a very hyper suggestible trance person who we can actually get them to be a good trance.
Mm.
To be in a good trance, you must be a very hyper suggestible.
Yeah.
You must not actually fight against it. You
Mm.
must submit to it. You must accept it. You actually then become easily to achieve that level of trance. So
Mm.
this need training.
Okay.
So that's why sometimes this deepening in trance, this deepening, we cannot use only one deepening, one deepener. We have to use several deepeners sometimes. Sometimes we take for a long way to deepen the person into from one deepener to another deepener until you're sure that he is really in a very good trance state that you can then suggest, we call it the suggestion, to improve in the subconscious mind.
Nice. Okay. Yeah, great. I think we had a good session. I think hopefully this session will allow us to have a good sleep tonight by
Yeah.
understanding
Yeah,
more about.
just listen to this subliminal kind of music.
Yeah, yeah, definitely. And then
Those
one of
kind
the
of
things is to put
yeah.
because the weather is a bit hot now. So apparently we can't sleep when it's too hot or too cold. So about 20 to 25 degrees, cool down your room. And then switch it off before you sleep is one of the good habits, practice as well to set up your
Yes,
environment, so to speak.
true, true.
Not doing any stimulating kind of activity is also very important to ensure a
Yes,
good sleep. And yeah, and this is the only time our brain can rest and rewire and our body can heal from within. And so when we wake up tomorrow morning, it's a Sunday, you spend family time, but you give yourself some time to perhaps do some exercise, prepare breakfast and spend the, quality of time before we move on to a new week again, right? And yeah, so also wishing all our Muslim friends selamat menyambut Ramadan soon
thank you.
and yeah, and then I think we hope to. I think one of the best things about Malaysia is because we're so multicultural. We get to experience different. I think especially I feel during the Ramadan, I think everyone. I mean, all the Malaysians feel that you go into a very spiritual, very because it's a holy month. I think it's great because we get to yeah experience different things like we see different people, but most importantly is to get good sleep and have a proper routine. Get some exercise, And yes, Puan Aida, yes, Salam Ramadan to everybody. Yeah,
Yeah.
she's wishing on the chat box. So yeah, to everybody, I think, as long as we keep on, yeah, when you're keeping it mindful, body, mind, spirit, I think our body will be able to tell you what to do, right? I think that's one of the best things. This is something that we are born to. We are born to, and then we are also very blessed to actually be able to make decisions, to make good decisions, wise decisions on how to have a good body, mind, spirit. So yeah, so with that, wishing everybody a good weekend, and
Yeah.
to see you soon. Yeah, we'll see you when we see you, right?
Yeah.
Right.
We can still have session if you want to, but we'll see how does the thing
We need to
goes.
adjust the timing as well, I think. Yeah.
Yeah, I can adjust the timing also.
Short
Yeah.
time.
I think
Yeah,
I think for before we end up, I just want to say that this is the best time now to re-look at everything, especially the way we eat, our eating habit. If possible now for this time around, I would try to say to myself again and again, try not to overindulge after the breaking fast, especially after 10 o'clock in the night. And sometimes we have non-stop eating until the morning 4 a.m. I think that is actually beating the purpose of actually the fasting month. At the end of the day, our body, our stomach is still not resting as much. It's not recuperating as well, especially in terms of the GIT system, the food and whatnot. So hope I can really be, how should I say, disciplined enough to be much better with regard to the content, the food that I take, not to try to eat a lot and things of that nature. So hope to all of our Muslim friends, try to get this as a good organization, a good self-discipline in terms of making a difference to ourselves for this particular month and subsequently on. Yeah.
All right. I think yeah, I think Coach Francis and I will also have a lot of uh advice and also sharing. And I also posted like a 7 day sahur menu.
Yes.
Yeah, for those
Mm.
who's interested, you can always visit my Facebook page, my Instagram, and we can get connected. So yeah, so it's so important to eat quality protein, hydrate yourself, even though it's fasting month, get a good sleep, and tuning this, because it's you're tuning more into your spiritual side. So I think that's one of the best way to reset
Yes.
your body, mind, spirit, your time, 130 days of the year, right? To do it. So yeah, so I think we look forward to everybody's progress, and yeah, we will definitely keep in touch. Stay safe, everyone. Have a good weekend.
Okay.
All
All
right,
right.
good
All
night.
right. Thanks,
Okay.
Prof.
Good
Thank
Thank
you.
you
night.
so
Thank
much, Prof. Thank
you.
you,
Thank you,
everybody.
All
everybody.
right.
Good
Good night.
night.
Thank you. Good night. Take
Tid-
care.
Tidur baik. Tidur baik,
Hi.
Prof.
Hi, Sakir. How are you? All right. Good, good.
Tidur baik.
Oh,
Ya,
tidur
tidur
baik.
baik. Tidur
Tidur
baik.
bye-bye.
Yes, yes. Tidurlah. Tidur mesti baik.
Okay, selamat malam semua.
Selamat malam, selamat malam. Okay, Syakir. That is a good bahasa.